my entire career, I've always talked to my patients, typically telling them that a bad bite when you're young is a bad bite when you're older. I wish I could tell everybody that crowding goes away, but it typically doesn't. Poor alignment between upper and lower teeth typically doesn't. So unfortunately, malocclusions when you're young are malocclusions when you're older. Some things can appear to look better at times, but for example, with upper anterior teeth, parents will come in and say, well, they used to have spaces and the spaces aren't there anymore, but they may have a poor relationship between their upper and lower teeth, and there may be some crowding. Things that, again, when you look at it, again, we don't look at a situation and say it looks good or bad. The orthodontist should be looking at your bite and telling you whether or not it is most stable and most functional or not. And we're trying to achieve most stable, most functional relationships because it's what promotes good dental health. When we talk about one particular problem, TMD, temporomandibular disorders, to avoid temporomandibular disorders, TMJ, sometimes they refer to it as TMJ, clicking or popping in the joint, or headaches associated with your bite. These are for real problems, and having a good occlusion that's balanced is going to help avoid those in a lifetime. And so those are functional issues that we talk about, and why it's important for teeth to meet together properly, and again, have a balanced type of a bite. There's a lot of parts to the oral system. You have joints, you have jaws, you have the dental component, which is the teeth that sit within the framework, and you have a neuromuscular system that runs all of this. All of these parts need to function in harmony if you're going to want to end up with a nice, stable, functional relationship that's going to promote good dental health a lifetime.